Hello everyone, welcome back to the channel. This is Amin Ibrahimi, physical therapist, and today we are diving into a question I get all the time from my patients. Which works best? Dry needling, cupping, or massage? These three treatments are incredibly popular. You see them all over social media. You hear about celebrities and athletes using them. And many people swear by one or the other. But when we step back and look at the evidence, the research, clinical trials, and real-world outcomes, the picture gets more interesting. So in this video, I'll break down what each of these techniques actually does, what the research says about their effectiveness, when one might be better than the other, and finally, my take as a physical therapist, how to choose what's best for you. Stick with me because I'll also bust some common myths along the way. Let's see what they actually are. Let's start simple. What are these treatments? Dry needling. This involves inserting a very thin needle into trigger points or tight muscle bands. Unlike acupuncture, which is rooted in traditional Chinese medicine, dry needling is based on modern anatomy and neurophysiology. The goal is to reduce muscle tension, improve blood flow, and reset dysfunctional muscle activity. Cupping. This technique uses suction cups placed on the skin. The suction pulls the skin and superficial fascia upward, supposedly increasing blood flow, reducing muscle tightness, and stimulating a healing response. It became really popular during the Olympics when Michael Phelps showed up with those famous purple circles on his back. Massage therapy. This is the most familiar. It can range from Swedish relaxation massage to deep tissue sports massage. Massage works through mechanical pressure, improving circulation, decreasing muscle tone, and also providing psychological relaxation. So, 3 different tools, 3 different mechanisms. Now, let's talk science. Dry needling. Multiple systematic reviews show that dry needling is effective for short-term pain relief, especially for trigger point-related pain like neck pain, low back pain, and shoulder problems. Some evidence suggests it can improve range of motion and decrease muscle tone. But the effects often aren't permanent unless combined with exercise and movement retraining. Cupping. The evidence here is mixed. Some studies show it reduces pain in conditions like chronic neck pain, low back pain, and even knee osteoarthritis. It seems to work by increasing local circulation and stimulating a mild inflammatory response, which may trigger healing. But the quality of the studies is lower compared to dry needling and massage. And remember, those big purple marks are not toxins leaving the body. That's a myth. They're just bruises caused by broken capillaries. Massage. Massage has a lot of research, especially for relaxation, stress reduction, and reducing delayed onset muscle soreness, or DOMS. For musculoskeletal pain, studies show moderate benefits, especially for short-term relief. It can improve mood, decrease anxiety, and make exercise recovery more comfortable. Like dry needling though, the benefits tend to be temporary unless combined with movement therapy. Comparing directly, for short-term muscle pain, dry needling often works faster. For relaxation and recovery, massage has the edge. For chronic pain conditions, cupping sometimes shows benefits, but results are inconsistent. So, none of them is a magic cure, but each has a niche. Here is where it gets practical. As a physical therapist, I don't see these as competing treatments. I see them as tools. If I have a patient with really stubborn trigger points, like in the upper trapezius or piriformis, dry needling can quickly reduce that muscle's goading, and then I immediately follow it with a stretching or a strengthening. If an athlete comes in sore from training or competition, and they just need to recover faster, massage is my go-to. It's not just physical, it helps them relax mentally, which is huge for performance. If someone has chronic pain, especially back or neck pain, that hasn't responded well to other treatments, I might use cupping as an adjunct. Sometimes it gives just enough relief to let the patient move more comfortably and engage in exercise therapy. The real key is integration. None of these should be used in isolation. The best results come when they are combined with corrective exercise, strength training, and education. So, what works best? Dry needling, cupping, or massage? The answer is, it depends on your goals. Need quick relief from a painful knot? Dry needling might be the fastest. Want to relax, recover, and reduce the stress? Massage is hard to beat. dealing with a stubborn chronic pain and looking for something different, cupping could be worth a try. But here's the most important takeaway. None of these techniques fixes the root cause on their own. They are tools, not cures. The real progress happens when you combine them with exercise, movement retraining, and lifestyle changes. So next time you're considering one of these treatments, think of them as stepping stones, ways to open the door so you can move better, train harder, and heal more effectively. Thanks for watching. If you found this video helpful, hit that like button, subscribe for more evidence-based health and physical therapy content, and let me know in the comments which of these treatments have you tried and what was your experience. See you in the next video.